Times are changing. Cancer is changing. The number of people surviving 10 years or over past their original cancer diagnosis is accelerating. However, the quality of life of these patients or survivors is far from a life of ease, as it is during this time that patients can face the unfortunate consequences of their cancer and their treatment. These consequences are often overlooked and can have a significantly negative impact on the well-being of the individual. My name is Sabrina and I am a research scientist at Future Genetics. Last week I attended one of the key NHS primary care conferences, which was at the National Exhibition Centre. I attended several interesting talks and there was one that stood out in particular. Dr. Anthony Cunliffe, a Macmillan National Lead GP advisor, spoke at the NAPC Annual Conference 2018 last week regarding the management of the consequences of cancer and its treatment in primary care. He began by telling the audience about his late mother's cancer journey, including the screening, diagnosis, symptoms and follow-up treatment. Although his mother managed to beat both breast and bowel cancer, the life she led following her treatment was extremely poor. She was offered limited support and the GP was not fully aware of how the cancer, despite being gone, was still affecting her life. Raising awareness of the importance and the extent of these consequences of cancer can have a great impact on the understanding and care provided by primary care teams and consequently the quality of life of cancer patients or survivors. For this to happen, primary care teams must consider not only the physical needs of the patient, such as managing the unwanted side effects, coexisting conditions, or risk of recurrence, but also consider the practical and personal needs, such as mobility, cooking, and personal care. Presently, these needs are often unmet due to several reasons. For example, the lack of communication between primary care and patients, or limited knowledge or confidence in identifying and managing the consequences of cancer and cancer treatment. Patients deserve to have a decent quality of life, and just as with any other condition, a better understanding is a step forward towards more effective care. Here at Future Genetics, we are focusing on a number of key diseases, including cancer, given the devastating consequences of these illnesses. Thank you for listening.